No matter how much we love our lives, some nastiest viruses will always surround us, which could be horrifying and deadly. Regardless of the era, humans have always had to deal with diseases like dengue and Ebola. Recently, coronavirus. The year of 2020 started with the fear of this deadly virus, named coronavirus, also known as COVID-19. It's a member of the family Coronaviridae, which includes severe acute respiratory syndrome, or SARS, and common cold. It came from a seafood and meat market in Wuhan, China in December 2019. Despite Wuhan and other Chinese cities being quarantined, the COVID-19 virus has spread to almost 70 locations internationally. The World Health Organization has already declared this virus a pandemic. A coronavirus is a virus that is found in animals and rarely can be transmitted from animals to humans and then spread person to person. Fever, coughs, and shortness of breath are the main major coronavirus symptoms, which range from mild to severe. It takes 2 to 14 days after exposure for symptoms to develop. Try to avoid people who are sick or meeting in large groups, and stay home if you are sick. Wash your hands often with soap and water for at least 20 seconds, especially after going to the bathroom, before eating, and after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use an alcohol-based hand sanitizer with at least 60% alcohol. Always wash hands with soap and water if hands are visibly dirty. Avoid touching your mouth, nose. Ebola virus. Ebola isn't as contagious as more common viruses like colds, influenza, or measles. It spreads to people by contact with the skin or bodily fluids of an infected animal like a monkey, chimp, or fruit bat. Then it moves from person to person the same way. Those who care for a sick person or bury someone who has died from the disease often get it. You can't get Ebola from air, water, or food. The virus first appeared during 2 1976 outbreaks in Africa. The best way to avoid catching the disease is by not traveling to areas where the virus is found. As the disease gets worse, it causes bleeding inside the body, as well as from the eyes, ears, and nose. Some people will vomit or cough up blood, have bloody diarrhea, and get a rash. It can also damage the immune system and organs. If you are in areas where the germ is present, avoid contact with bats, monkeys, chimpanzees, and gorillas, since these animals spread Ebola to people exactly like Nipah virus. You may be able to get the vaccine from the World Health Organization. Epstein-Barr virus. A member of the herpes virus family that can infect humans, this infection is very common, and you've probably already contracted the virus without even knowing it. The condition that you may associate with this virus is infectious mononucleosis, or mono. However, experts are researching potential links between EBV and other conditions, including cancer and autoimmune diseases. It spreads from person to person through bodily fluids known as cytomegalo, particularly saliva. This is why mononucleosis, one of the most well-known EBV infections, is casually known as the kissing disease. But you can also get the virus by sharing personal items, such as a toothbrush. It can also be spread through blood and semen. You can start spreading this sickness to others as soon as you contract it. This means you can pass it on to others before you even start to have symptoms of an active infection. Over time, EBV can cause several complications, including weakened immune system, lymphomas, hemophagocytic syndrome, which is a rare immune disorder, and even organ failure. Although no medication can cure Epstein-Barr till today, for prevention, you can get plenty of rest, drink lots of water and other fluids to stay hydrated, suck on lozenges or ice pops, or gargle with warm salt water to make your sore throat feel better. Influenza B. The illness results from a virus that spreads very easily from person to person. Someone can contract the virus by coming into close contact with that person who has the infection, or by touching a surface that the infected person has touched, then touching their own mouth or nose. In many people, the flu goes away on its own without treatment. However, older adults and people with certain underlying health conditions may have a risk of developing serious complications, such as ear or sinus infections, pneumonia, or even bronchitis. Any of these may require a person to need treatment in a hospital. In extreme cases, it can lead to death. Several over-the-counter medications can help ease the symptoms of influenza. These are easily available from drugstores. Antiviral drugs can reduce a person's recovery time by around 2 days, but they're only effective if a person takes them within a few days of the symptoms starting. Nipah virus. One of the newly emerging zoonoses that can affect both human and animals. This is a highly contagious and deadly virus for which there is currently no vaccine or treatment for humans as well as animals. The natural host of the virus are fruit bats, who are symptomless carriers. Infection can progress silently in humans without showing any symptoms. However, people infected with this virus usually display influenza-like symptoms. Once a person is infected with Nipah virus, it usually takes 5 to 14 days for an infection to appear. The only thing that can help a patient suffering from this disease is intensive support.